This is for ABGs, so we have a physician that has ordered arterial blood gases. So we're going to go to the patient's chart, check for any bleeding disorders or see if there are any blood thinners. This would just indicate we have to hold pressure after the needle stick. So we would go to the patient room. Hello, Mr. Blank. My name is Trisha. I'm with the respiratory care team. Doctor has ordered arterial blood gases today for you. This is different than your venous blood. That's usually what you've been getting drawn in the morning. We're going to do arterial blood gases. So this is going to show us at the moment how your breathing is affecting you today. So I'm just going to poke a little bit lower in the arm. It is still a blood or a needle stick, but it's going to be a little bit lower. So I would wash my hands. Mr. Blank, can you tell me your name and date of birth? Verify the patient. And then we would put my gloves on. And then we have all of our supplies. We have our needle, our Band-Aid, our rubbing alcohol, gauze pad, gotta remove that there. We have our cork, and then our device to remove the bubbles afterwards, as well as our bag to transport. So, all right, Mr. Blank, I'm gonna perform a test first. This is just gonna let me know if you have the correct or the right amount of circulation that we can utilize this arm for it. So I'm gonna go ahead and block your radial and your ulnar arteries. And then make your hand into a fist for me, and I'll have you release it and make another fist and release it again. See how your hand is blanched right there? I'm going to go ahead and release pressure on the ulnar artery, and your hand is pinking right up very quickly. So that just means you have enough circulation. We can utilize this arm. I'm also going to palpate, and I feel that artery very strongly right there. So we'll go ahead and use that artery there. So first I'm going to clean it. You would take your cleaning pad, rub in a circular motion for 30 seconds, and I'm going to clean my fingers. And here's my syringe. I'm going to pull back at least 5 cc's, a little bit more, so that we get enough blood into the syringe to be analyzed. I would remove my cap here. And then I'm going to go ahead and palpate again. And then we're going to go in at a 45-degree angle with the bevel up. So we're going to go ahead and poke very slowly. If we don't see any blood, we're just going to pull back a little bit until we get that blood. It's going to be a little bit lighter than venous blood. That syringe is going to fill, and then we're going to use our gauze pad here to hold pressure as we remove the needle. We put the needle into the cork. Got that in the cork here. We're going to hold pressure for at least 5 minutes. If they are on a blood thinner, have bleeding disorder, we're going to hold at least 10 minutes of pressure to that site. Then we're going to check the site, and we're going to apply a Band-Aid to the site. So then we're going to fill out our paperwork. We want to our patient name, ID, the time we've taken the sample, their oxygenation status, if they're on ventilator, if they're on oxygen, we would include that information. And we're going to remove the syringe from that cork, and we're going to go ahead and place that into here to remove any bubbles from that syringe. Then we would put our syringe into the bag and transport it to lab, get it to them as quickly as we can for analysis.